Pancreatic cancer, 5-year survival rate under 15%. That is the number that keeps oncologists awake at night. And it is also the number that frightens everyone, including doctors. It sounds harsh, but it is not the actual problem. The actual problem is what happens before. Because this cancer does not appear suddenly, it is prepared, over years, by processes in the body that we consider completely harmless or that we simply do not have on our radar. I had a patient, 61 years old, non-smoker, no excess weight, no diabetes. He came in for a routine checkup, no complaints. 3 months later, the diagnosis, pancreatic cancer at an advanced stage. And looking back, the signs were there. We simply misread them. And 2 of the factors I am going to show you today will surprise you, because they have absolutely nothing to do with diet, nothing to do with toxins, and nothing to do with being overweight. The research is fairly clear on this. It is never or almost never a single factor. It is a combination of mechanisms that reinforce each other in pancreatic cancer, on which this cancer can then grow. And no, it is not genetic factors and destiny either. That is only a fraction of cases. Running through almost all of these factors is a common mechanism. And if you understand that, you understand the whole problem with this type of cancer. And also why most preventive screenings for this cancer simply start too late. Medicine in recent decades has often waited until the house is on fire. And unfortunately, so have patients, who then expect a miracle from the doctor when the roof is already gone and only the foundations are left standing. And that is exactly why it is all the more important that we talk about one thing: the silent, quiet, chronic inflammation, also called silent inflammation. It is not the inflammation you know, with swollen knees, fever, redness. It is an inflammation that runs in the background, completely without symptoms and without warning signals, and permanently puts the body in a state of alert that you feel absolutely nothing of. And that is the big problem with this type of cancer too. The immune cells constantly release messenger substances, interleukin-6, TNF-alpha, signaling substances that should actually only be active briefly during infections. At the same time, aggressive oxygen compounds form that attack cells and repeatedly cause small damage to the DNA. Normally, the body repairs this, but in the moment when these repair mechanisms no longer work, a cancer can develop. When it happens continuously, day after day, year after year, the probability that the errors remain increases. And when errors accumulate, something can get out of control. The tissue changes. Scar tissue forms, the so-called fibrosis. Support cells are reprogrammed, and suddenly the tissue promotes growth instead of stopping it. New blood vessels form, and these ultimately supply what should no longer be supplied, namely, degenerated cells. The immune system recognizes these cells less and less well. A study in the journal Science in 2021 showed that exactly this inflammatory memory in the pancreatic tissue actively promotes the formation of tumor cells. The tissue, so to speak, remembers previous inflammations and reacts with altered cell behavior. You can think of it like a soil that is being prepared for cancer over years, completely silently and unnoticed. And this soil, it can be influenced, but only if you start early enough. This state runs through all the points we are going to discuss now. And now comes the first point that you have probably never heard of in connection with the pancreas. It is oral health. More precisely, periodontitis. That is the chronic inflammation of the gums and the supporting structure of the teeth. I know what you are thinking. What does my gum have to do with the pancreas? The answer is, more than you can imagine. Epidemiological studies show a connection between poor oral health and an increased risk of pancreatic cancer. A study published in 2025 in the renowned journal JAMA Oncology examined the oral bacterial and fungal microbiome of thousands of participants. And certain bacteria were detected in the studies sometimes years before the cancer diagnosis in the affected patients. Years. Not months, years. That is absolutely remarkable. How is all this supposed to work? The mechanism is actually logical once you understand the picture. The chronic inflammation in the mouth acts systemically, meaning on the whole body. The bacteria enter the bloodstream through the inflamed gums. We swallow them. The immune system has contact and remains permanently activated. And the metabolic products that these bacteria produce influence body cells that are far away from the mouth. Through the digestive tract, the bacteria can also get close to the pancreas. Researchers have described the so-called oral intestinal axis, the direct connection between the oral microbiome and the tissue of the pancreas. I want to put this into honest perspective. Poor oral health alone naturally does not cause pancreatic cancer. The data comes from smaller studies. We are still at the beginning here. But as part of a disturbed system, it is possibly an early marker to recognize an increased risk early on. And the practical consequence of all this is quite simple. Go to the dentist regularly. Get periodontitis treated. Do not put it off. Now comes the second point, where most people think it does not affect me. It is about pre-diabetes. Most people believe that pre-diabetes is not yet a real problem. The doctor says, well, we need to monitor the long-term blood sugar level. Come back in a year. And that is the real problem. Because in that year, nothing happens. The patient goes home, feels fine, changes nothing, comes back the next year, and the value is a little higher. And that is how it goes year after year. Several meta-analyses and long-term studies show pre-diabetes alone increases the risk of pancreatic cancer by about 20 to 40%. In 2024, a meta-analysis was published that comes to exactly the same result. In 2025, a national cohort study was published in the American Journal of Preventive Medicine, asking, what happens when pre-diabetes persists and what happens when it regresses? The result is unequivocal. Those who reverse their pre-diabetes through lifestyle changes reduce their risk measurably. Those who do nothing increase it further. And the important thing is, pre-diabetes is reversible. In many cases, completely reversible, with dietary changes, with exercise, without medication, but only if you act early enough. This means, if your HbA1c value is rising year by year, if your fasting blood sugar values are becoming borderline, then that is not a moment for waiting. That is a moment for action. The HOMA index is a valuable tool here. It measures insulin resistance, and it detects a beginning problem years before blood sugar itself becomes abnormal. Ask your doctor about it. It is a simple blood test. Now we come to the factor that is at the top in all studies. It is smoking. It is the strongest avoidable risk factor of all. In tobacco smoke, there are nitrosamines, chemicals that literally alter and destroy the genetic material. Important genes are changed, including the KRAS gene, which is involved very early in the development of pancreatic cancer. Then comes the oxidative stress from constant smoking. Then, the chronic inflammation. Then, the poorer blood supply to the pancreatic tissue. And all of this together creates exactly that soil we talked about at the beginning. Just 10 cigarettes per day, about 50% higher risk. 20 cigarettes per day, almost double the risk. 30 to 40 cigarettes per day, more than double the risk. And now comes the important part. Even former smokers are still somewhat higher than people who have never smoked. But the risk slowly falls after stopping smoking. After 15 to 20 years, it approaches the risk of non-smokers again. This means it is always worth quitting, at any age, even at 60, even after 30 years of smoking. The body has a remarkable ability to recover, if you give it the chance. Now we come to the big point of type 2 diabetes. And here the decisive question is not, what does blood sugar do? But what does insulin do? Because in type 2 diabetes, the insulin level is permanently elevated. And the big problem is that this elevated insulin level counts as a growth signal. The insulin activates certain signaling pathways and tells cells, divide, grow, survive, multiply. and the damaged cells that should actually die no longer do so. The so-called AGEs also form advanced glycation end products, sugar protein compounds that damage cells. Then we have a lot of oxidative stress, chronic inflammation, and always the same fertile ground. And then there is a particularly noteworthy connection. Newly onset diabetes can sometimes be an early signal of an already existing tumor, because the tumor itself can disrupt glucose metabolism before it is detected. This means, if someone suddenly develops diabetes without a clear cause after the age of 50, if someone who had normal blood sugar values for years suddenly develops high values, then this needs to be investigated. That is not a reason for panic, but it is a reason for examination. This, of course, does not mean that every diabetic will get pancreatic cancer. The number is 0.5 to 1%, but it could be an important signal to catch more people earlier and save more lives. Then we come to belly fat. Not the fat under the skin, but the visceral fat that deposits deep in the abdominal cavity around the organs. And this fat is anything but passive. It is an active metabolic organ that constantly produces inflammatory messengers, intensifies insulin resistance, and negatively influences cell growth. Visceral fat cannot be seen or felt from the outside. A large belly suggests it, but even slim people can have too much visceral fat internally. Waist circumference is a simple indicator. Over 37 inches in men and over 31 inches in women is considered elevated. Particularly dangerous is the triple combination: visceral fat, blood sugar disorder, and lipid metabolism problem. Doctors call this the metabolic syndrome. And this syndrome shows in the large analyses a significantly increased risk for pancreatic carcinoma. Then there is still a nutritional factor we need to discuss. It is the consumption of processed meat products in combination with heat. Strong frying and grilling produces nitrosamines and polycyclic aromatic hydrocarbons. These substances attach to the DNA and can trigger mutations. It is not directly about meat, but about the processing. Curing, smoking, many ingredients in combination with strong frying. If you eat a steak occasionally, that is certainly no problem. But processed meat from a package every day, salami, deli meats, hot dogs, that is a completely different subject. And a small but important addition about alcohol. There is also a connection here. Chronic alcohol consumption directly damages pancreatic tissue. It is one of the main causes of chronic pancreatitis, and chronic pancreatitis is itself an independent risk factor for pancreatic cancer. The connection runs again through the same path: chronic inflammation, tissue damage, increased risk. And then there is one more point that is missing from almost every list. It is chronic stress. Not as a lifestyle factor, but with a measurable biological impact. It is about the permanently elevated cortisol. Cortisol in brief bursts is life-saving, but when it remains chronically elevated, week after week, month after month, something very specific happens. It activates inflammatory processes. The immune system recognizes degenerated cells less well. Blood sugar rises, even without dietary changes. Insulin resistance increases. Stress alone does not cause cancer, but it amplifies all the mechanisms we have talked about throughout this entire video. It is, in a sense, the amplifier that makes everything else louder. And now there is one more field of research that is truly fascinating and that you probably have not heard about yet. In 2019, a study was published in the journal Cell that showed bacteria are not always bad. Bacteria are directly detectable in the tumor tissue of pancreatic cancer patients. But differently from what you think, when a certain favorable composition of bacteria was found in the tumor tissue, the patients had a significantly better survival rate. It is a completely new field of research. The question being studied: can good bacteria in tumor tissue help us strengthen the immune system? Another study showed that the pancreatic microbiome actively influences the immune response in the tumor. This means, in any case, avoid bad bacteria, Promote good microbiome. What can you do concretely then? First, stop smoking. That is one of the strongest levers of all. Those who quit reduce their risk measurably, even if it takes time. Good support programs exist today. Use them. Second, keep an eye on blood sugar. Not just when the doctor says it is getting serious, but when you see that your values are creeping up year by year. The HOMA index can help detect a beginning insulin resistance early. Ask your doctor about it. Third, diet. If you do not know where to start, follow the Mediterranean diet. Lots of vegetables, legumes, olive oil, fish, little processed meat. It is the dietary pattern that always scores best scientifically, also in cancer prevention. Fourth, exercise. 30 minutes of moderate exercise 5 days a week. It improves insulin sensitivity, reduces visceral fat, lowers the inflammation level, strengthens the immune system, more than any single medication. Fifth, oral health. Go to the dentist regularly, at least twice a year. Get periodontitis treated. Do not put it off. Sixth, get chronic infections treated. Do not ignore them. Get tested for Helicobacter pylori. Get tested for hepatitis B and C if you have risk factors. Seventh, reduce alcohol. Not zero, but regular heavy alcohol consumption is a real risk for pancreatic tissue. Eighth, manage stress. Not as a wellness tip, but as a medical necessity. Chronically elevated cortisol has measurably negative effects on all the mechanisms we have discussed today. This cancer does not come overnight. It grows on a soil that has been silently prepared for years. And this soil, it can be influenced. With the right decisions at the right time. The 15% survival rate mentioned at the beginning, it is not set in stone. It falls when we start too late, and it can rise if we start acting early enough. I hope this has been helpful. Stay well, and I will see you in the next video.